Thank you very much, Dr. Okoneda Amola, the brain developer of this great group. I want to thank you for the in-depth introduction and the insight into what P.H.R.E.D is really about. So tonight I've been saddled with this great and huge responsibility, and I stand with all humility and respect to be able to be the one to introduce my teacher, my mentor, and a big brother to me tonight in the person of Professor Olayinka ILESANMI. So Prof is actually a medical doctor with a Master of Science in both epidemiology and then medical statistics, as well as global health policy and management. He also has an MBA, an MPH, a PhD in public health, and also he's a fellow of the West African College of Physicians, Community Health. Professor ILESANMI has over 18 years of experience as a public health specialist with expertise spanning across health systems, strengthening primary health care, disease prevention, capacity building, and outbreak response. As an adjunct professor of public health, he has supervised more than 10 PhDs and MPH candidates and published more than 315 manuscripts, one of the highest in Nigeria. On Google Scholar, Prof has more than 105,000 citations, and his citation index, I think, is about 90%. So we know what that means. Professor ILESANMI has attended and presented in over 60 conferences within and outside of Africa. He has reviewed abstracts and moderated sessions. He has won several awards and have several certifications in Nigeria and abroad. He won the National Youth Service Corps Honor Award in Nigeria. At the end of his residency training in community health, he was adjudged to be the best fellowship candidate in the Faculty of Community Health of the West African College of Physicians. In the year 2020, he was the best researcher for the year among the Medical and Dental Consultants Association of Nigeria, University College Hospital, Ibadan, Nigeria. He ranks among the highest cited researchers in the field of epidemiology and public health in Nigeria, and has consistently been among the top 2% cited researchers globally. A few weeks ago, he was listed as one of the 100 best researchers in Africa, being one of the only 4 Nigerians on the list. I think this deserves a round of applause at this juncture. In 2018, he was a postdoctoral associate at the Yale School of Medicine, where he made significant contributions to the librarian medical education. At the College of Medicine, University of Ibadan, Nigeria, he was a clinical epidemiologist and taught epidemiology, community medicine, and global health. He was also jointly appointed to the Clinical Virology Unit of the College of Medicine's Infectious Disease Institute. He served as an honorary consultant for the University College Hospital in Ibadan, Nigeria. He is currently the West Africa Region Program Lead at Africa CDC. He is also an adjunct professor of public health at the Lead City University, Ibadan, Oyo State, Nigeria. So please, with a standing ovation wherever we are, I would just want us to applaud this great, humble, and respected researcher. So Professor ILESANMI, you're welcome on board. And then tonight, to help us with moderation, I would like to introduce an also humble individual in the person of Dr. Lawrence Ekeocha, who is also a P.H.R.E.D fellow, global health and then international development expert with extensive experience in HIV/AIDS, TB, and malaria programs. He's privileged to moderate the session tonight. Thank you so much, Dr. Lawrence, for all you have been doing and all you still do tonight. So he's also ably supported by a lady that is next to none who has been so supportive in the person of Mrs. Rosemary Dixon Unze, who has over a decade of experience in public health space. She has implemented TB, NTDs, malaria, and then nutrition, and then HIV projects for this number of years. So please join me to welcome and then set the ball rolling. Prof, you're welcome once again, sir. And then Dr. Lawrence and Mrs. Rosemary, you have the floor.
Thank you so much, everyone, and good evening, everyone. Thank you so much, Prof, for accepting to be here in our midst. I truly want to appreciate you, and I must tell you, I'm privileged to anchor this session. So my colleague will be joining us shortly. At the moment, he asked me to ride on while he joins us. So, Prof, once again, I want to really appreciate you for all you've done, and then appreciating you for standing in as the first speaker, first guest on F.W.A.C.P Network. I truly want to applaud the work you've done so far. I'll just go straight down into the questions, just a few of them. And then after the session from us, we'll be throwing the ground open. However, we'll be using the Q&A. So please, audience, if you have questions as we ask, kindly drop your questions at the Q&A. Would highlight it as we talk. So, Prof, the first question will be, we've seen so much work you've done over the years, and I know it did not just start all of a sudden. So we want to hear the story. Can you tell us how this manuscript writing started? And again, what motivated you into starting the work? Thank you, and over to you, Prof.
Okay, thank you so much. Before I start, I would like to appreciate this opportunity to talk to colleagues about my experiences over the years. And I want to appreciate Dr. Kunle Daramola, the convener of this group, the Public Health Research Evidence Dissemination Network. And I'm also proud to be a member of the network, and I appreciate what you are doing. I think we all need to continue to do the little we could at a different corner. By the time we brighten the corner where we are, I believe that everywhere we get illuminated with time. So let's keep on doing that, which we have been doing. So thank you once again, Mrs. Dixon, Mrs. Rosemary Dixon. I appreciate you also. I'm glad to meet you. Now, when it comes to research, I started residency at University College Hospital, Ibadan. And I happened maybe to be fortunate to have senior residents ahead of me who were actually willing to impact knowledge. Now, the first person that I met as a resident doctor, who was one of my seniors then, happened to be a lady who was always willing to share knowledge. And the background I had, before I came into the residency, I was a medical officer at a state specialist hospital where I was employed in the Department of Surgery. And we had few hands in the hospital. So by the time I started residency, I left the medical officer position to start my residency training. So I noticed that the volume of work where I was coming from was actually more than what I got to start with as a resident doctor. So then I was always looking for more things to do. So this young woman, one of my senior residents, now told me, who had just also passed a Part 1 exams at that time, told me that anytime I am in the departments, having nothing to do, I should always come to the senior resident's office. We used to have a room for junior, another room for senior residents, and the third for the chief residents. So sitting down with her, she was able to teach me a lot of things. And fortunately for me, within the first, I think maybe less than a year of starting residency, the department was invited to a medical outreach. And I was part of the resident doctors at the outreach, and we were able to collect some data sets. And luckily for us, a group of nephrologists came from Lagos. The outreach took place in Ibadan. So the nephrologists came from Lagos with some sophisticated tools. They were able to collect a single blood sample, analyzing so many things at the same time and the like. So they were able to, I think they had full blood count done, a renal function test, and some other laboratory tests. So we also took the BMI, weight and height of the participants. We took their age and some other data. At the end of the outreach, they requested that we should share with them the data that we collected. We did. And they also promised to share theirs with us whenever it's ready. And they did. They shared with us their own data. By the time we got back to the department, the team lead for the outreach, who happened to be one of my mentors that I referenced a lot, Dr. Adebayo Mati, he just told me that the data we collected, have you entered it in SPSS? Then I didn't know how to enter data in SPSS. I doubt if I had a laptop then. I don't think so. So he now said I should go and learn how to enter data in SPSS. That was how my journey into research began. And luckily, one of my colleagues taught me how to do data entry in SPSS. So after entering the data, I told him, I was excited that, yes, Chief, I've learned how to do data entry. Now I've entered it in SPSS. He now asked that, have I done the analysis? Wow. I felt that was another bridge to cross. That how will I be able to analyze data? Because I've not been taught. So one of my colleagues also put me through, and that's other senior residents who was always willing to teach, Dr. Simboige. So she also taught me, oh, when you want to analyze, this is where you click. If you click here, you see mean, you see mode, and so on and so forth. So I finished the analysis. I now went back to this, my senior, my chief, who now said, the data you enter, you've analyzed, you need to write an abstract. I was wondering that, why is it that one thing would lead to the other? So I wrote the abstract. And a few weeks after writing the abstract, there was a call for abstracts by the Association of Public Health Physicians of Nigeria. So he told me that I have to submit the abstract to the conference. So when one of my senior colleagues saw the abstract, I said, no, the abstract was not well written enough. We wrote it together. We had to go back to the data sets to do some reanalysis and the like. So I sent the manuscript, the abstract to the conference, and the abstract was accepted. After accepting, I don't know what's next. I went back to this, my chief, that the abstract has been accepted. They said, yes, that's fine. I need to go and learn how to do the slides so that I will do the conference presentation. All this happened within my first 8 months to 10 months in the residency training. So I did the analysis, wrote the abstract, and then I went to the conference. That was my first conference so ever. I went to the conference, I made the presentation. I was excited that, wow, so this is how to present in a conference. So on getting back from the conference, this same senior resident, my chief, told me that there is a need for me to write the presentation in a full manuscript form. So I went back to the other younger senior residents who taught me how to write manuscripts. So after writing that manuscript, I submitted it to a journal. It was reviewed over and over, several back and forth, and it was published. So when I got that done, I felt, oh, so this is how to get published. Then my name, if you put it on Google, you just see Facebook, maybe one other thing, maybe my secondary school group. But then I put my name on Google. I just saw the manuscript, the title, and my name popping up, and I was encouraged. So that was how I started, and that was just my first paper. And after that, I had to do more. I kept on learning from these, my senior colleagues, when they are also doing their own work, even their part two work. I help them data collection, part of data analysis, part of writing. So I use this to learn. And after the first, I think the first is usually the most difficult. After the first, it was like, oh, so if I could put all this effort together within 6 months or 7, 8, less than a year, then I could do more. That was how I started the journey. They started collaborating with me with the aim of teaching me. By the time I learned the rudiments, the skills, I was able to also write my own manuscript as a first author. So within the first 1 or 2, 3 years of my residency, I'd published over 10, and it continues from there. So thank you. So
Thank
back
you so
to
much. Yes, thank you so much for that insightful um, um, session that you just gave us. The descriptions you went round and round, and quite interesting. So one of the things I could see here, that there was a continuous learning, and then you were actually doing something. So colleagues, I think it would be nice to, this is really good for us to hear that it was not cast on stone. He came in as a novice, no idea at all. He actually started from the scratch and became who he is at this moment. So Doc, I would like you, Prof, I would like you to respond to some of these. So I heard you when you were talking, you talked about some back and forth when you were asked to convert the abstract into manuscript. I think I would like to hear more about the back and forth. How was it like? What exactly were the back and forth? Tell us more about it. Over to you, sir.
Okay, thank you once again. Now, after writing the manuscripts, I submitted it to a journal. That was after my senior colleagues also have reviewed. So I submitted it to a journal, and the manuscripts, it was not rejected, but the comments that I received from the editor was a bit overwhelming. I had to, it was as if I started the whole work all over again. Why this? A lot of questions on different part of the work. So I went back to my senior registrar who was there for me as a mentor. So mentorship is actually very important apart from continuous learning. You need someone who has gone through whatever you intend to do and who is ready to mentor. So I went back to her and I told her that they've rejected this man. I said, no, 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 this is not rejection, because I didn't know the difference between, I was a novice all through until I started learning. I didn't know the difference between rejection or accept. I just said, I got a mail from the editor and they gave, in fact, a lot. She told me that anytime you submit your manuscripts and you have a note from the editor that is as long as this, it implies that the editor is interested in publishing your work. That what you need to do is to work on it and make it publishable. So then I addressed all the questions with the help of my senior colleagues who were there for me as a mentor. So we addressed all the questions together and I resubmitted just with minimal editing. The second or the third time, it was accepted. So that was a real excitement. It was as if I won a jackpot. I was really excited that so all these efforts has now turned to a full published manuscript. So the back and forth has to do with reviewing and reviewing the manuscripts, looking at it again, changing some tenses, reviewing from English, rewriting some part of the methods, questions. The reviewers, they were not there when the work was done. So they felt we knew more things that we didn't tell, that we didn't add to the manuscripts. So I had to explain a lot of things. And it was indeed a very nice and interesting learning opportunity for me. Thank you. Back to you, moderator.
Thank you so much, Prof. Thank you. For me, it's a learning process too, to hear this from you, because some of the times we hear people like you, we're like, maybe you were thrown from the earth, you were thrown from the heavens with all this, having about 100 and something citation over some decades. That's a very good and a very commendable work done so far. So this is really interesting. So one of the things I could take home from what you've said is that there is need to have a mentor when you are about to write a research, when you get into the research space. One of the key things there is that you have someone to fall back on. And like you reiterated over and over, you had someone that you always run back to whenever you get those comments. So one of the key things, again, I also picked from what you were saying, when there is a long review, long questions, long things, it shows interest in what you have written. It shows that the journal is interested in what you have written and want to probe further. Just as you said, just reiterating as you said, that they were not there when you carried out the research. So obviously, they want to know more. They want to be sure of what you're actually talking about. So I think that is one of the aspects I like to hear, and that's a good one. So I will be going down into, so now I see you had, the initial time you had a mentor that saw you through the process and helped you tackle those things. Was the mentor always there? Did you get to form more teams to actually know, to do more work, or was she always there all through the period you started, when you started the writing and all?
Okay, thank you once again. Now, when I started, my mentor that I mentioned was a senior registrar who also was preparing for her own Part 2 exams so that she could finish her residency. So she was there. I made some inputs, or I used the opportunity of Part 2 work to also lay some part of research. So she was always there throughout the residency. And immediately she finished her residency, she left. Despite the fact that she left, by then we could communicate through emails, through phone calls and the like. So we kept communicating. Even I think about 2 years ago, I got to know her in 2009, and up till the last, I think, 2 or 3 years, she still reviewed or made some input to one of my work, despite the fact that she's very busy and she's at the top of her career rather. So I have someone. But one thing I would like to add is that having a mentor that is willing to put you through is very important. And you also need to show some commitment. Yeah, when you have a mentor is there to put you through, you also need to, someone might say that, oh, they want to use me to do data entry for them. I don't think there is anything like that. Each time that you have, in quotes, been used, it's always an opportunity to learn how to do something new in another way. So I assisted them once in a while, even to do their own work. And with that, I kept learning. I kept asking questions. And apart from having a mentor, you as a mentee, you need to show the passion for learning and also be ready to give what you have also to your mentors. If the mentors are using their time to teach you, to put you through, you also must be there. There should be something that you are given in return. Maybe anytime they have something to do, they have work to do, you should also be there to support them. And by doing that, it's also a learning opportunity. Thank you. Back to you, Mrs. Rosemary.
Thank you so much, Prof. Thank you for that insightful word once again. The commitment from the part of the mentee is very vital, just as Prof mentioned, just to reiterate. So the next question would be, have you ever had a rejection? So you have talked about the reviewers actually putting comments on your manuscripts and then you giving a response and eventually got published. Have you ever had a rejection from any journal at all? And what was the story?
Okay, thank you so much. I think I would like to use timeline so that people can relate with my experience. The first manuscript that I said I ever started was in 2009. Now, this year is 2024. I still had a rejection this year. So even though I've done pretty well, I've published a lot, and I still had a rejection this year, 2024. So that's about how many years into the game or into the business. So that's more than almost about 15 years. I still had a rejection. So manuscript rejection occurs when a submitted manuscript is not accepted for publication. So despite you may be very good at it, and having your manuscript rejected actually doesn't mean that you have done a poor job. It doesn't mean that what you have written is not good enough. It's not that what you are written cannot be accepted elsewhere. So it's just, there are a lot of factors which probably we'll be able to talk about later. So having manuscripts rejected is something that I've experienced on a yearly basis. Even this year, I've had it as well. So thank you.
So when you mentioned even this year you had a rejection, that's a consoling word for us that are just beginning to hear that even Prof had a rejection this year after 15 years of practicing. So I would like to probe further. What are the factors that could make a manuscript to be rejected? Thank you, and over, sir.
Okay, thank you once again. Thank you. Now, rejections are common, as I started saying, and there are several causes of manuscript rejection. So maybe I will just allow you to stop me. Maybe by the time you think you have had or you've gotten enough reasons for manuscript rejection. Now, let me start with the misalignment with journal scope. At times, when you submit journal, maybe you have written something to you, oh, it's something very interesting, very educative, enlightening, and so on. And your plan is to get it published. And you have looked at one high-rated journal, oh, let me just get it into PAMJ, let me get it into BMJ, let me get it into Lancet, and the like. One, if there is a misalignment with the scope of the journal, no matter how beautiful, now nice, how detailed, how sound the methodology of your work is, it will definitely be rejected if you don't align with the scope of the journal. Now, if there is a journal of diabetes and what you have done is on maybe health education among healthcare workers. If it doesn't align to the scope of the journal, no matter how good or well written it is, it will definitely going to be rejected. Now, apart from not aligning your manuscript to the journal where you want to publish it, if the article or the manuscript doesn't, if it is not novel enough, that is more or less nothing new, we usually say, and so what? After reading it and felt, okay, and so what is the author trying to say? So if the research does not add significantly new information or new insights to the field, the journal may not see it as impactful enough for publication. And some of these journals, they have number of pages that they want to publish at a time, and it costs them extra to do that. So by the time you are bringing in something that may not really be novel, something that everybody has probably written about, or something that is not of interest, then the journal may not want it. Now, another thing that is also important that I would like us to take note of is the methodology of the write-up. Methodologies or methodology, they are very important in the research work. So if your methodology is weak, or if there are flaws in your methodology, and this is actually, I also review, and I've reviewed for several journals, and I'm still reviewing for several, and I've been editor-in-chief even for journal. I noticed some colleagues who just send papers with flawed methodologies. Once you see that, it's almost irredeemable. The method section of the paper is the section of the paper that will tell people exactly what you have, how you did what you have done. Now, if you have done it well, and your results, probably you did not present it well, and they can review and tell you that, can you represent your results? Use this method to present it, and so on. But when the methodology, when it is flawed, for instance, if you want to do a study and the minimum sample size should be like 300 or 400, and you have studied 20, there is nothing to review, there is nothing to send back to you to correct. That one is meant to be rejected because you've not studied enough people to be able to give the evidence that you are trying to give, to be able to give the analogy that you are trying to give. So if there is a flaw, such as sample size, maybe you have done a case control study, and the control and the cases, they are not matching each other. They are from different, they are nothing in common. The manuscripts, the editor-in-chief will look at it and felt, if at all we want this person to make corrections, the corrections is almost impossible. You can't go back to the field and add more. You can't go back to the lab and do this. So those kind of papers are actually rejected outrightly. And poor data presentation. If the data presentation is unclear, if it is confusing, you've done something nice, you spent money, time, and resources, and the data is poorly organized, if it is, then it is difficult for reviewers to interpret the study's results. They may want to reject it immediately. But if they know that, oh, this result is nice, is good, but the way you have done it, there is a need for you to use another method, then they may give some guidance and send it back to you for review. But immediately they see that it is completely poor, nothing can be done about it again, then such a paper will be rejected. So as I said, there are several reasons. Maybe just to add a few reasons for rejection of papers. Another thing is maybe inconsistent writing. People write inconsistently. At times, when you are in your introduction section, you are already discussing the finding of the work. When you are in the method section, you are already bringing in results. So if the manuscript is difficult to read, if it is difficult to understand, or if it contains, how do I put it now, inconsistencies, reviewers are already struggling to understand your key messages, then they will just ask you to take back your manuscripts, that they cannot process it further. And when manuscripts are rejected, I, as an editor-in-chief in the past and also review, there is a way they carve the letter that, oh, thank you for doing this wonderful work. And, we have so many articles at the time. This article is not of priority to the journal. Now, they won't tell you that this article was poorly written, except if they don't want to be nice enough. They won't tell you it's poorly written. So you should be able to. Now, it is also better if your manuscript is rejected and the editors, they gave you the reason why. that's good. You can improve on it and send it out. But once your manuscript is rejected, and the reason for the rejection was not mentioned or communicated with you, you need maybe an extra eye to see the manuscripts. You need to share with someone else to read and tell you what you can improve on. I've received manuscript from a few colleagues in the past telling me that, oh, this manuscript was rejected. We didn't know the reason. And immediately reading it, said, oh, look at this. I will be pointing things out. Okay, rewrite this, change this, add this. And at the end of the day, they got their work published. Now, also, if you are having inadequate literature review, your manuscript is likely to be rejected. Now, literature review is like the backbone that you are building on. So probably a work has been done that shows us that the prevalence of hypertension amongst Nigerian population is about, let's say, 25 to 35%. Well, that was actually one of my findings in time past. So now, if you are doing your own study and you are using a prevalence that was reported about 20 years ago, and there are new literatures that you have not been able to add, then it may be difficult for your manuscript to scale through. Now, as I was talking, I think I saw Professor Olayinka sending something to the chat, so it just caught my attention that some people plagiarize work. Plagiarism is one important thing. Most editors now, what they do is once you submit your paper, they put it into plagiarism checker. There are several software for that now. So once they put it and they notice that, oh, this paper is already published or majority of the work is plagiarized, they see a lot of repetition and so on, they may not want to publish it. And also, if there's something called salami technique, people just slice the same data sets, the same work. Maybe you did a study in a rural community among farmers, and you now want to publish among female farmers. You want to also publish among male farmers. And at the end of the day, you are even plagiarizing yourself. You are almost everything in one paper. You are repeating it just because you want to have numerous publications. So once the editor-in-chief notices this, your manuscript is going to be rejected. The other minor reasons, maybe your writing style is not clear enough, it's difficult to understand, even though you have not plagiarized, you've done literature search, you have done a lot of things, but you are just not so clear enough. They may reject it outrightly. And also, the way we normally write, some people, when they write their conclusion, the conclusion is not usually from the fineness of the work. When people write conclusion, maybe I've carried out a study among patients living with HIV/AIDS who are on medication, maybe adherence to antiretroviral therapy. Probably that's what I've worked on. And my conclusion is that the hospital staff should employ more staff. The healthcare workers should give regular appointment to the staff. And the work has not shown anything that there is a need for more staff. The staff are not there. No, the work has not shown that. The work has just shown us that probably some of the patients or some of the persons living with HIV/AIDS receiving medication, they live very far from the hospital. So because of that, they pay a lot on transportation and they ended up missing some of their appointments. That may be the finding of the work, but I'm now concluding that the hospital needs to, there's a need for the hospital to employ more doctors, more nurses should be employed. So people just give some comments or conclusion that probably are not so relevant to the work that they have done. In such a case, the editor is bound to just reject. But if the editor found that, okay, well, apart from this, the work may still pass or go through, they can ask you to rewrite the conclusion and so on. So I think I will need to stop here so that I will allow the moderator to guide the conversation.
Thank you so much. Thank you. I didn't want to stop you because I was actually taking notes, and for me, it's a very great learning process. And I want to really appreciate you for coming out very clear and stating out the points. So the points are really clear and straight to the points. And the session is also recorded. So I'll also turn over to the audience. If you have questions, you can just drop it in the Q&A. There is someone taking notes of that and then throwing it back at us to ask. Prof. We may not want the audience to talk because of network glitches. It may obstruct or elongate the time. I know Prof is actually a very busy person, and I wouldn't want him to extend longer than we want him to be here on this call. So, Prof, thank you so much for those wonderful courses you have just listed out. And it's reassuring to hear that, yeah, a journal can actually reject your paper and then it could be accepted somewhere else, right?
Yes.
That's good. So, but then there needs to be an rearrangement, kind of like the first point you laid out was misalignment of the journal scope. That's one of it. So I think one of the feedbacks here, how do one know the scope of a journal that you want to send an article to? How do one know the scope of that journal? Thank you, and over, sir.
Okay, thank you so much. Aside from knowing the title or the name of a journal, there is a need for you to read the instructions for author. All the journals have a guideline or instructions that they want the authors to follow. And now I would like to add that what a journal accepts, another journal may not accept it. For instance, a journal may want you to write, I'm just trying to use something very simple, an example. A journal may want you to structure your abstracts. That is, you separate introduction, you put introduction, write your introduction, put methods, write your method section, results, write your results, and so on. But some journals, they may not want you to do it that way. And the same content, merely the fact that you have structured one and the other one is unstructured, may be enough reasons for some journals. So what I will advise us to do is that I don't usually wait until I finish writing my work before thinking of the journal where to publish it. What I do is that I try to read the instructions for author, and then once I look at it, by the time at the manuscript writing stage, I will just start to put in to format my manuscripts. And sometimes, if the manuscript has been rejected by journals, is rejected, I will need to read the instruction for authors. And there is a need to take time to prepare your manuscripts according to the requirements of the journal. The way they want it. If they want you to write your capital in uppercase, in your title in uppercase, then you go along, you do it. Some of them usually some journals have templates that you can be doing some copy and pasting. If you have prepared your documents or your manuscripts in Word, then you can be copying and be pasting it using the format on the version that you are pasting it. So if we read the instructions for authors very well, I think it should go a long way to guide us, and it should minimize, let me say, outright rejection. Because rejections are usually when you submit your manuscript to a journal, the editor-in-chief will look at the journal, the manuscripts. So the editor can decide to reject it right away, even without sending it to reviewer. But most times, if it is not actually bad, plagiarized work, something that cannot even be forwarded. Now, once it goes through the stage of being seen by the editor, and the editor felt, okay, this one is not, and they have ticked down some of the dots and felt, okay, let me send it to reviewers. Then they send to the reviewers, and the reviewers can also decide that the editor should reject it. They can guide the editor to reject. So, but most papers that are rejected at the points of submission when it gets to the editor, that means they have a lot of flaws. So that's why they reject at that point. So to summarize and to go back to the question asked, I think there is a need for us to take time to read the instructions for authors over and over again before we format our manuscripts, and let's take the time to process the formatting. It is as important as the work itself. So we can take time. If you have a team, 3 or 4 persons working together on the manuscripts, and you notice that one of the team members is more careful, can pay attention to dotting all the I's, crossing all the T's. So those are the kind of person that you assign to submit the manuscripts. So let me go back to the let me give it back to the moderator.
Thank you so much, Prof. Thank you so much for those wonderful comments. So I think there are some questions on the chat box, and I would like to read it to you, sir, for you to help us respond to them. So one of it is, before I go into that, if you have questions, I think we have some time. You can actually raise your hand while we turn it over to you. And just to mention that the second moderator, Dr. Lawrence, is on a call, I will just go ahead and read out the first question, and while he goes ahead with the rest. Okay, so the first question says, could you please dwell on research work with a qualitative method, sir? That's the way it's written here. Could you please dwell on research works with a qualitative method? So the person that is asking this question presumes that what you've been doing so far has been quantitative work. So you'd want to know more about the rejections around the qualitative methods of research. Thank you, sir. Over.
Well, I think that is a very good question. Now, everything that I've said so far applies or can apply to both qualitative and quantitative manuscripts. Most journals can also take mixed method. Some journals take mixed method. Even there are few journals that actually take only qualitative manuscripts. So the difference is not much, if there is any at all. Once you follow the instruction given by the author, by the editor, the instruction for authors in the journal, and you format your work appropriately, it will go through at least the first stage, through the editor, then to the board members or the reviewers. So it's the same process when it comes to writing your manuscripts and the submission and submitting it. And another thing is that even the review of qualitative work, it may be even more rigorous, because they need to be convinced that, unlike when you are showing your data, you are showing statistics, you are showing this and that, for qualitative work, it takes more rigor to be able to get your work published. So both qualitative and quantitative needs to be properly done, follow the steps that we have highlighted earlier, and ensure that you read instruction for authors, and also ensure that you follow the processes and get your work submitted. No plagiarism, no error. Try to do all your parts, and also show well, these days, I doubt if I've not, in the last few years, I've not seen a single authored publication. All my publication, I doubt if I had a single author publication in the past. I don't think so. If any, probably one. So try to give your work also to your co-authors after finishing the write-up. Let them read, let them make inputs. Most times, if 4 or 5 people have read a particular manuscript and made their inputs before sending it for publication, most times I doubt if the editor will not be okay with the manuscripts. And also the reviewers will find it interesting because you've done all the correction. I had a work written by my colleagues at work, myself, about a year or 2 ago. Now, part of the authors, it was part of the work that we did at the peak of COVID-19 in Nigeria. Some of our authors are from the UK, some from the US, and so on. We work together as a team, on IPC, on case management, and the like. So all of them, they reviewed over and over and over again. By the time we submitted it to Global Science and Practice, it was just minimal comments, minimal review that we had. So we just, well, after seeing it, they were asking me that how was the correction, the comment. I said, no, the comment is minor, it's something I could just undo. So once your authors, all the authors have worked and made inputs, it makes your work easier and the publication process usually free. Thank you so much. Back to you, Mrs. Rosemary.
Yeah, thanks very much, Prof. Your input have been very insightful, and apologies for jumping in onto the call now. I had an emergency I needed to quickly attend to. That's why I'm coming a bit late. Please, apologies. Yeah, we've read so much about you. I mean, you're a scholar. I many of us long and yearn to be like you. I have a question here that will need your response. Someone is saying here, so I've discovered a number of our papers were rejected on the excuse of no reviewer or poor delayed response from the reviewer. How do we handle this? What's your best counsel on how this could be handled. I discovered that a number of our papers were rejected on the excuse of no reviewer or poor or delayed response from reviewers. How do you think this can be handled? Thank you.
Okay, thank you so much, Dr. Lawrence. At the point, the network seems fluctuating, but I would like to repeat your question to be sure that I got you well. So the question is talking about how to undo delay by the journal after submitting your work. If they don't get back to you on time, how do you undo this? Okay,
Yes.
thank you very much.
Yes.
So nothing, that was what you said. So now, I think I also have experienced this in time past. Now, what I do personally, my experience is that I have a tracker, just a common spreadsheet on a Microsoft Excel. So most of any work that I'm doing, sometimes I have research team that work together. So whatever I'm doing, I will just put it there. Number 10. I will write exactly what the title is. I will write the journal that I'm planning to send it to if I have not sent it out. And let's say I've sent it out, I will I will put the name of the journal, the day that I sent it out. If there is any comments, I will put it there and so on. Now, I'm able to, at one glance, track all the papers that I have submitted. Now, if I look at it and say that, oh, I submitted this paper and it is almost 2 months, I usually give the editor or the journal board about 2 months. That's about 8 weeks. After that, I will send a mail to the editor. So thank you. I believe that you received this manuscript with the number, so manuscript submission number, this, title this, submitted on so dates. Hope the manuscript has been reviewed. I'll be anticipating a favorable response. So I'll just write a short email to them. Now, most times, the editor-in-chief, the editor of the journal, they will reply. They will send a reply to that. I'll receive replies. Now, on I think a few occasions, I've received a reply saying that they have not been able to secure reviewer. And we can't blame them. I mentioned earlier that I review for several journals, but it is not all the papers sent to me that I ended up reviewing. Sometimes I reply them that it's a busy period. Can you wait till the next 5 weeks? Can you wait? Once they send you a paper and they said that they want you to review within the next 2 weeks, and I looked at my schedule and felt that, in the next 2 weeks, I may not have time to review this. So some of the reviewers also, if not all, they are not being paid for the job done. I've never any payments at all for reviewing a journal in a journal. However, there was a journal I reviewed for, and they told me that if I'm able to review like 3 in a year, they will publish one of my work free. And I took advantage of that. That if my work has been reviewed and accepted for publication, they are going to waive the publication fee because I've reviewed for them like 3 times in that year. So once you do that, you send you submit. After like a month or 2, write a letter to the editor. And if they tell you that, they inform you that they don't have a reviewer. Now, some journals will request that, do you have suggested reviewers? It's fine. Most times, they won't send the papers to your reviewers, to your suggested reviewers. Now, in the institution where I work, if I submit names of reviewers, what they will do is that when they get any paper from others, they will send your paper to them, to your suggested reviewers, and they will now send your paper to another reviewer. So that's what they do. So, but if you do this and they delay, maybe they have spent 6 months, no communication. If you write a mail and they are not replying you, if you write and it's getting to 1 year, I think you can write back to the editor and tell them you want to submit your manuscript elsewhere. Well, I think it has happened to me just like once or twice, writing the editor that I would like to send my paper to another journal if they are not able to give feedback by probably the end of the month. And I think 1 out of the 2, they sent a feedback and the work got a favorable consideration. But I think just only one, I had to send it to another journal for publication. So that's what I have done and my personal experiences. I believe that many of us on the call have also our own experience as regards delay from the journal. Back to you, Dr.
Perfect, sir. You hit a very strong point that a few of us have had to pass through. I do understand that sometimes it's not as straightforward as people outside think. Reviewers are human beings like you are, and some of those delays are bound, but it's only proper if feedbacks are actually given. This person is worried because sometimes no feedback at all, and it could be very painful. You know how it is to do all of this midnight work and nobody gets back to you. It could be that painful. But thanks again for your response. Quite insightful. How can a passionate mentee seek and find a willing mentor to guide on the process? So this is a mentee who's asking for possibilities of finding a good mentor for guidance with research, with regards to research publication and and the likes. So sir, maybe I'll just give you 1 or 2 minutes
Okay.
to just say that. Thank you.
Oh, fine. I'll keep the time. Now, you need to look for you to get a mentor. It is better you look at your immediate environment. It's not all of us that will have a mentor in our immediate environment. I narrated my own story when I started my residency. 2 of my senior residents, they stood out. I gained from many people. Many of them contributed to me, to my training, to my learning. But two of them, if I could say, even they were the one that reached out to me. Then they noticed that I have some passion, that I was just passionate about learning and so on. So you should look at, because if you happen to be a microbiologist and I am a public health physician, I could mentor you on research generally. But by the time you go to the lab and you culture some specimen, you are seeing some things different, I may not be able to make inputs into that. So it's good for you to look at your immediate environment. Maybe if you are a master's student, some of your lecturers, you can approach them. Or you can, even your supervisor, when you are given the supervisor, your supervisor may be, I actually supervised a young lady in UI who happens to, in fact, I think the 2 of us, we have published, I think by now, it should be more than 80 manuscripts together. I supervised her just about 5 years ago. And we ended up working together up to today. We still have ongoing work. So my advice is that look for mentors in your immediate environment. Then if you can't see or you can't get one, you can look outside your immediate environment. You can have mentors that you communicate remotely, but start from where you are. People that they actually know you, people that you can also be of benefit to. As I said, it's not only that the mentor will be reading your paper, telling you one day, your mentor may tell you to go and do one qualitative data collection. You also should make yourself available. So it's like a win-win. It's you give and take. So it's not as if the mentor will be spending time on you. The mentor may do some things that may not even be relevant to what you are learning or what you intend to learn. The day the mentor will tell you that, oh, I am in a meeting, my children are in the school, could you quickly get them and bring them to the office so that I can, you should also be willing to give back to your mentor. If you time, you give to your mentor. Your mentor has a lot of things to do with time. You can help them to save some of their time to mentor you and contribute to teaching and other things. So I think I would like to stop there because of time so that I get back to you, Dr. Lawrence.
Yes, sir. Thank you. Thank you very much, Prof. Thank you. You see, the questions are so many, and I just need to, keep them on track as they come. Sorry for, boxing you with a time limit. And I believe this will not be the first. We'll still bring you on board because a lot of questions are coming in, from our colleagues. I don't know if Dr. Kunle introduced the platform. I know he did, but you see, on this platform today, there are 2 sets of people who are on this platform. 2 of them, one is community of interest, and then the other one is community of practitioners, community of practice. So I see a lot of people brainstorming around different questions like we see on the field, where we are. So sorry, we're coming, with some of these very pressing questions at this time. We see it as a privilege anyway. So please gladly, kindly allow us to open up all of our hearts. So sorry about that. Another question here, sir, is so how can a researcher identify the right journal or publisher? That's one. Two, publishing fee. Publishing fees from some journals could be very challenging. Are there credible free journal, or what pathways will you suggest? And then number three is, how can one identify predatory journals? So three in one. How can a researcher identify the right journal or publisher? Two, publishing fee. Some journals could be very challenging, maybe expensive. That's what he's trying to say. Are there credible free journals? And then how can one identify predatory journals? Yeah, let me allow you, sir. Thank you.
Now, to start with the first question, how to identify the right journal? Well, what I tell my colleagues, or what I do, is that anytime I finish writing a manuscript, I normally start from the list of my references. If I've written a manuscript and I've cited about, let's say, 15 references or 20 references, I will look at the journals that I've cited. Now, if my work is on contraceptive use in Nigeria, definitely I would have cited like Journal of Reproductive Health, some journals that are publishing things related to the product. So by the time you look at your list of references, you can start from there. You can also get maybe a guide from from mentors. You can ask them, oh, I have senior colleagues who are working on reproductive health. I can talk to them that, oh, I have this paper that I've worked on, maybe with a paper from my PhD or for my master thesis. So definitely they can also provide guidance. Another thing you can do is that if you want to select the right journal, always ensure that you don't box yourself to a journal that is published in Nigeria or probably published in different part of, I want to publish in a journal published in the US. That doesn't make it very very high profile journal. So what I've said is, start from your list of references. Apart from the list of references, you can consult your mentors to give you guidance. And if you do this and you are not able to find journal to publish your work, in time past, maybe more than 5-6 years ago, what I used to do is that I go to the directory of Open Access Journal. The directory of Open Access Journal has a lot of journal, DOAJ. I've not said that for a very long time now, but like 5-4 years ago, I was a regular visitor to that particular journal website, the platform. So in that particular place, they have a list of journals. I can't say for now, I don't know the number of journals, but at the time, the journals there, they are more than 10,000. So you can look at the directory of Open Access Journal. You will be able to see journals in public health, journals. You can select different types of journals that you want. Maybe journals in epidemiology, journals in global health, family planning, reproductive health, dental health, diabetes journal, and so on. Now, once you select your area of specialty or the area that are relevant based on your keywords, you will look at the journals. Then you can also decide based on the fee. The second question is about the fee. Some publications, some journals, they up to like $3,500. This money is, apart from those who are grants, and you have already factored in the publication fee as part of your expenses. We want to say that it's almost impossible for any of us to save our hand-earned salary to publish a journal that is almost 3,000, 2,500 US dollar. It is almost impossible. I will not encourage any of us to save our salary for 6 months or a year just because we want to publish a single journal. Now, how do we create this? I said earlier that you need mentorship, anything you do. There was a time to publish a paper in BMC, and one of my colleagues just published in BMC. And I knew that this, my colleagues, her salary is almost the same thing. And I believe that she probably didn't use her salary. I called her, I found out from her that I saw your publication in BMC. How did you do it? He now explained to me that after submitting the article, at the point of submission, he wrote a letter to the editor that this article was not funded, that it was the authors that contributed money to carry out the study. That because of this, they are in academic institution, they don't have funding for publication, they can't afford the cost of the publication, that they will appreciate if they could waive the publication for them. And the editor replied that, well, if the article is accepted for publication, they will continue the discussion about publication fee. I did the same and I got my work published. So you need to talk to mentors. You need to talk to people that have gone ahead to guide you so they can advise better on the issue of publication fee. And the last part of that question is about predatory journal. The truth is that it is usually very difficult to know the counterfeit or the fake from the real. It's just like having real gold or fake gold. Many people may not be able to tell what the difference is. Now, what's our advice in terms of predatory journal is that there are some qualities or features that once you see, you should run away. Now, if you submit your work to a journal and any correction without any review, your manuscript is accepted immediately the way it was submitted, I want to beg you not to publish your journal in such a journal. It is predatory until proven otherwise. It is. Now, another thing, most times some journals will just tell you that submit your work and we'll get it out, it will be ready in 3 days, in 24, 48 hours. Most of the journals canvassing for manuscripts that way, I want to say that they are predatory journals. Now, the reason why I say most of the journals, it is possible you have a journal that is authentic, it's not predatory, and probably they lack 1 or 2 articles to complete the number of articles that they want to publish in a particular edition. So they may solicit for papers. So the fact that a journal is soliciting for manuscripts does not make it fake. It does not make it predatory. So, but if they don't review, they just accept, then it is. If the turnover time is beyond, it's not too short, then it is likely to be predatory. There are several other reasons, several other factors, but most of the other factors, it is usually very difficult. Once again, you also need mentors, people that have gone ahead, people that have done it before. They can guide you. On a daily basis, I receive almost letters from different editors. I think almost between 10 and 15 on a daily basis in my spam folder. Requesting, oh, I'm the editor-in-chief of so publish your work here, publish your work there. I'm not saying all of them are plagiarized or predatory journal, no. But most of the journals in such categories, most of them are predatory. On their websites, you'll be seeing typographical mistakes, errors, but that does not mean they are predatory because they may be in a country where English is not their official language. They may not be primary English speaker. But once you are seeing such, it's a sign that you should be careful. And there are several other reasons, but I would like to stop here because of our time. Back to you, Dr. Lawrence.
Great. Thank you. Thank you very much, sir. I'd like to open up the platform for some of our other researchers who are on the platform to ask their question. After this question, I'm going to ask Professor ILESANMI. So please, anyone that has any question or contribution, I know Professor Morenica is on the call and other erudite scholars. Please, I'll open up the platform for you after I ask this one more question from Prof. Prof, we know we are in we are a low middle income country, like you know. So this one is taking Nigeria as a case study. Why is it pretty difficult to publish in Nigerian journal? Some initially will ask, accept, accept a submission and ask for payment. But after payment, they come and say, you know what, your research suffered rejection. because it's not novelty enough, it's not innovative enough, and all of that. Do you want to throw a line to that? Why do you think this is happening within our space?
Okay, thank you. I want to believe that the journal probably did not collect publication fee before the outcome of the peer review. Some journals, they collect submission fee. When you are submitting to them, they collect a token as submission fee before giving out the article for peer review, before sending it for peer review. If that's what they have done, if you have paid submission fee, and they would have written the caveats on their websites that the payment of the submission fee does not guarantee that your article will be accepted. And the submission fee is not usually much, it's usually minimal. Then at the point of peer review, if they have found your work to be good enough to be published, then you now pay the publication fee. But in a case where you have paid the publication fee and the article probably was later rejected, I think the article or the journal should be able to refund that fee. That's my take on that. So read the instructions for authors very well. You may be able to submit or pay a submission fee, but I don't think it's ideal for any journal to collect publication fee and then declare the article rejected. It is also not something common. So, and I've published a lot in several journals in Nigeria. I've not had that. I've not had such experience from any of the journals I've submitted to. So we can't also generalize that. There may be a reason why that was done. Maybe one of the reviewers, probably the work was sent to 3 reviewers or 2, and only one of them sent in their inputs. Yeah. And the editor decided to accept the journal, the article for publication in this journal. And probably by the time the reviewer, the second and the third reviewer submitted their own comments or reviews, they felt, no, we can't go ahead with this. At such points, I expect a refund. So now you will probably want to allow other colleagues on the call where I think maybe they should just make inputs rather than questions, maybe input to some of the questions that I've answered already, maybe make some additions, and so that we can hear them.
Yes.
Some of those two on the call. So I would like to learn more from them.
All right. Thank you very much. So Madam Amaka, can I hand over to you to kindly ask those who have contributions to also make their contributions. Professor Morenike, I learned you on the call. Please, I've not met you in person, but oblige us this privilege to make some contributions to what Professor has just said. Can you just make 1 or 2 contributions?
Yeah. Good evening, everyone. It's a pleasure to be here. Always a pleasure to be where you're doing this. And due salutation to you, Lawrence. Due salutation to Esther. And thank you, Professor ILESANMI. Pleasures. I know you, but I'm also seeing you for the first time, I guess. And I'm hearing your voice. Yeah. I think the issues is raised are perfect. I'm not sure I have any other addition. What I had an addition to, I submitted online. But brilliant, not just hearing you, but also corroborating the things I knew and learning new things. Thank you very much for the excellent presentation, and thanks for organizing this. I'm grateful. Over.
Thank you very much. Thank you very much, Prof. You didn't allow us to see your face, but it's okay. It's fine. We'll not fine you for that. We'll bring you on board. We'll bring you on board next time.
It was on screen. Yeah, okay. Prof.
Yeah.
Sorry?
I put on my video. Yeah.
Oh, okay.
Prof's video is on. Prof,
is it on?
It was your own screen.
Yeah.
Oh, really? Okay.
It's on. Yeah.
All right. Thank you.
All right.
Thank
you.
Okay. Now I'm seeing the wonderful face. Thank you very much, ma. We appreciate your coming. We don't take this for granted at all. Thank you very much. We really appreciate. So let me also open the mic for other people who would like to say 1 or 2 things, please. Anyone? We have few minutes left, 3 minutes, and then we'll shut down. Any other person?
Just to add, Dr. Lawrence,
yes,
we have
please.
Dr. Damilade on a call, and I think it would be nice to hear from him. Over to you, sir.
Please, sir, please, over. Dr. Tamilade, are you on the call?
Oh, yes, I'm on the call. Sorry,
All
I
right,
was a
sir.
bit distracted. And
Sorry.
can the request be made again?
Okay, so we said we are happy that you are around. Can you add one or two lines to what Professor Morenike and Professor ILESANMI have just said around all of our discussion this evening around research, publication, rejections, and every other thing, advice you like to give to young mentees who are also on this call?
Okay, thank you so much. It's a pleasure being here. Professor ILESANMI and Professor Morenike have been my mentors at large. I've been following them for a while. And I always like to gain as much as I can from them. And I have also again tonight. So maybe the only thing I would just like to add is the fact that, like Prof. ILESANMI said, the starting point would actually be to look at the journal. What is the scope of the journal, the aim of the journal? What is the author's guideline? What are the instructions for the author before we even start putting the manuscripts together? So that at the end of the day, this may reduce the likelihood of rejection. Thank you, and over.
All right, thank you very much. Prof, we sincerely want to thank you. So we'd like to give you the next 1 or 2 minutes to make just a final word, advice, guidance, and every other thing you'd like to just say. Thank you very much.
Oh, Dr. Lo, once again, I think before I say anything, I would like to appreciate Professor Morenike. I've learned a lot from her as well, and also my colleague, Dr. Ebirongbe. So thanks for adding your voice to the conversation. Now, what I would like to add is that anytime you submit your work for publication and you have a rejection, so there is a need for you to see it, and maybe don't see it as maybe the end of the world, kind of. Yeah, in those days, there was a time I made a submission and my paper was returned back to me, not rejected. But when I saw the comments, it was overwhelming. So always take time to process the comments. Don't be in a rush. Analyze the feedback. Try to identify areas for improvement. If you didn't probably receive any much comments, show it to colleagues. A colleague of mine sent a manuscript to me that he has sent it to like 2-3 different journals and it was returned. They rejected it. Immediately I looked at it. I said, well, I just mentioned almost 3 or 5 reasons why it was rejected. And he went back, we worked things, rewrite some parts, and it was eventually published. I wasn't a co-author. It was my friend's work. I just read, and so identify areas for improvements. And also seek a mentee's perspective. I think the role of a mentee in anything we do, a mentor rather, the role of a mentor cannot be overemphasized. Up till now, there are people I still talk to when I get stuck. Some of them, they are not really, it's not as if we talk on a daily basis. I'll just call them, I have this problem, what do I do? And stay motivated. If you have seen anybody who has published 2, 3, 4, 5, 6, 7, 8, 10, 20, 30, 40 times, that means that person is someone who can take correction. The person is someone who is ready to learn. That's it. If you have seen someone who has published 20, 30 papers, that means they've corrected, they've reviewed the person's work 20, 30 times. And the person is someone who is able to take to correction. So it goes a long way. So let's stay motivated. Rejection is a normal part of the research and publication journey. I said even this year, 2024, after like 15 years that I've started writing, I still had my manuscripts rejected. And I've mentioned the reasons why it could be rejected. So each revision and resubmission refines your work and it also makes it stronger. So let's stay motivated. Thank you very much. Back to you, Doctor.
Thank you very much, Dr. ILESANMI. We are very happy for all of this very insightful congratulations insightful input. We are so grateful. Thank you for finding our time. Dr. Kunle is raising his hands. I want to hand it over to him. Dr. K, over, please. Thank you.
Thank you, Dr. Lawrence, and Mrs. Amaka for that wonderful moderation. I want to appreciate once again our guest speaker, Professor ILESANMI. Thank you so much, sir, for dedicating your time for this important topic. We appreciate everything you've done to make sure that you build the capacity of as many mentees as possible. And I can see from the chat box that there are a lot of people that would also be interested in having more of this guidance. I also appreciate Professor Morenike, who has been supportive of the FRED platform, and Dr. Demlade too, Dr. Demlade Ibirongwe, for lending his voice to this important conversation, and to everyone for taking time out of their busy schedule for being on this call.